Hi, doctors. I'm Tim Lewis, a professor at Multimedical English that helps you with USMLE clinical skills. Okay, so let's talk about hand washing. It's one of the most, uh, sometimes it's kind of confusing on what we're supposed to do. If you go to the USMLE.org webpage, it says you only have to do one of them. So you can use gloves, or you can wash your hands, or you can use hand sanitizer that's at the door. And so you don't have to do two or three. I've had doctors wash their hands, then put the gloves on, and that's not necessary, okay? So you only have to do one. And really all you have to do is wash your hands before you examine the patient. So that's basically what you have to do. However, a lot of doctors say, well, what if I did some of the exam and then I went back and I touched the patient again? Did I have to re-wash my hands? And they have many type of questions. So let's put hand washing in perspective. Basically, the USMLE exam is not about hand washing, right? It's really about how well you get a focus history, how well you do a physical exam, a good focused physical exam, how well you counsel the patients, how well you close them, and how well you document the cases. So let's keep it in perspective. I had to remind this to a few students. They were so worried about how they do the technique of hand washing. Like I said, although it is important, we have to keep it in perspective. So do that when you're getting ready for the USMLE. And even afterwards, I think after you take your test, where I get the most calls is, doctor, is it okay if I did my hand washing like this or that? Well, remember, they're not going to fail you if you did really well on the exam, even if you forgot to lose your hands. Remember, USMLE is not about whether you wash your hands or not. It's really about all the other things that are involved in clinical skills on getting a good history and taking care of our patients. I hope that helps you. I'll talk to you guys later.